We now reach the final chapter of Brain and Behavior, in which we're going to be covering the portion of chapter 6 that covers drugs. When you look at the effects of drugs on the body and behavior, this is the study of pharmacology. Pharmacology is how drugs affect the nervous system and behavior. And what are drugs? Drugs are chemical compounds administered to produce a desired change in the body. So I want you to think about this definition of drugs for a second. Drugs are chemical compounds administered to produce a desired change in the body. So most of the drugs are covered by the Food and Drug Association, FDA, and they are reviewed to make sure that they are safe. What are some chemical compounds that qualify, that meet the definition of a drug, that are not administered or are not overseen by the FDA? And I'm not talking about illicit drugs. I'm talking about things that are not illicit. So think for a second if anything comes to mind. When I've asked this in the past in classes, people have said teas, herbs, and a big one is supplements. Supplements like melatonin, for example, which we talked about in the sleep. Melatonin is currently a supplement that you can take. There are a number of supplements, also vitamins, that technically meet the definition of a drug, but then are not overseen by the FDA. And this has created a number of problems. Supplements in particular cover a wide range of drugs. You can have supplements out there for weight loss and supplements out there for sleep that are not melatonin, supplements for a range of things from depression, anxiety, mood disorders, appetite. The challenge is these are marketed as supplements, but they're really drugs. But the vast majority of people that are purchasing these supplements do not realize that they are purchasing drugs that can have potentially very, very negative consequences on their body. So drugs that are coming in from other places around the world that are dangerous, sort of herbal medicines, all sorts of things that need to be careful in terms of dosage, that can really affect your behavior. These are sold as supplements to consumers that do not realize what it is that they are ingesting. All in all, there are all sorts of times that drugs and medicines are marketed as being able to help with certain conditions, and many, many times they do. I mean, of course, there are medicines that are very, very essential and important, but these medicines have been tested. They've gone through clinical trials. They make sure that the potential benefits to those taking them outweighs the risks. So unless something has gone through that degree of rigorous study, then you really want to be careful taking it. I see all the time on TV these commercials for, oh, we finally found this solution to weight gain. There is no drugs out there that are going to let you eat whatever you want and not gain weight. If it sounds too good to be true, it is, and you should avoid it. So in general, one of the things that I want to make clear with regards to drugs and this chapter is that there are all sorts of chemical compounds that can greatly affect your body that are not necessarily marketed or sold as drugs, but they are. They technically meet that criteria, they fall under that definition, and so you really, really want to be careful. And this is the last chapter in this class, and I think it's fitting to leave drugs for the end because the allure of drugs to many people, the addiction that can surround them, the importance that they have for aiding in recovery of certain medical conditions, All of this is best understood after you have learned how it is that the brain communicates with the body, how the brain forms representations, how neural activity underlies behavior, how it would be that drugs would actually affect your nervous system and your behavior. So I'm hopeful that at the point that you're listening to this and reaching the end of this class, that you are going to be able to have a more critical eye with regards to evaluating the influence of food, vitamins, drugs, physical activity, behaviors that are healthy for your body, behaviors that are not healthy, so that you can try to overall make choices that will lead to a healthier life for that of yourself and your family. So, without straying too much, I'm going to return to the principles of pharmacology and delve next into psychoactive drugs. A psychoactive drug is any substance that acts to alter mood, thought, or behavior and is used to manage neuropsychological illnesses. So this is an example, of course, of drugs that have ideally gone through clinical trials so that they have a greater benefit to risk ratio. Psychoactive drugs are typically prescribed for mood disorders or thought or behavioral disorders, and so they have particular effects on your body. In order to understand how drugs affect our body, you need to understand how drugs are administered and how they make their way to the nervous system. To be effective, a psychoactive drug or any drug has to reach its nervous system target. There are a number of routes of administration that influence the rate and the degree to which the drug reaches its site of action. So drugs can be administered orally, they can be inhaled into the lungs, they can be administered through rectal suppositories, absorbed from patches applied to the skin or mucous membranes, or injected into the bloodstream, into a muscle, or even they can be directly injected into the brain. So there are primary routes, again, for drug administration and absorption. One is ingestion. So this is an oral route. This is easy and relatively safe. An absorption via digestive tract is, however, unpredictable. So we spoke before about melatonin as a supplement that you can take, but the effect greatly varies because absorption via the digestive tract is unpredictable. So some people are able to absorb the melatonin supplement effectively and others are not. You also have injection. This bypasses the digestive tract. And you can inject subcutaneously, which would be under the skin. You can inject intramuscularly, so into large muscles, or you can inject intravenously, which would be into veins. So this would be drugs delivered directly to the bloodstream. Of these, ingestion and injection, the intravenous route is going to be the route that will be fastest to reach the brain. In addition to orally and injection, you also have inhalation. This is common for tobacco and marijuana. This is absorbed through the capillaries in the lungs. This is also common for asthmatic medicine. You also have absorption through mucous membranes. The nose, the mouth, and the rectum are the most common mucous membranes that are utilized for absorption. Nose would be, for example, those nasal sprays that are sort of steroid injections and nasal sprays that would help with sinus congestion. And then the mouth, you can have lozenges, and then you have rectal suppositories. Of these routes, oral administration is easy and convenient, but it has the most barriers to the brain. It has to travel through digestion, so it takes a very long time and it has to pass many barriers to reach the brain. So if you were to take something orally, then it has to be significantly stronger than if you were to take it intravenously, or even if you were to inject it in the brain, because a great deal of the medicine is going to be lost before it even reaches the brain. There are fewer barriers for a drug destined for the brain if the drug is injected directly into the bloodstream. The fewest barriers are encountered, of course, if a psychoactive drug is injected directly into the brain. What is key to know is that with each barrier eliminated en route to the brain, the dosage of a drug can actually be reduced by a factor of 10. So that gives you an idea of how much drug is lost on the way to the brain. So the primary point of blockage for drugs reaching the brain is the blood-brain barrier. The blood-brain barrier helps prevent most substances, including drugs, from entering the brain via the bloodstream. So in addition, there are a number of barriers to the internal movement of drugs, cell membranes, capillary walls, and the placenta, but the blood-brain barrier is by far the most effective at preventing drugs from entering the brain. So of course, sometimes you don't need to have drugs enter the brain. Not all drugs are designed to enter the brain. Advil, Tylenol, they don't necessarily need to enter the brain for them to be effective. But psychoactive drugs and a number of other drugs that would influence the interplay of neurotransmitters and the communication of cells in the brain to try to affect and change mood, these need to enter the brain. If you're going to have anything for Parkinson's disease, Huntington's disease, these are all disorders of the brain. So anytime you have a disorder of the brain and you're going to try to treat it, then the drug that needs to treat that disorder of the brain would need to enter the brain, and it needs to pass the blood-brain barrier. Endothelial cells that make up capillaries located throughout the body, these are actually not tightly jointed. So it's easy for substances to move in and out of the bloodstream. But the endothelial walls in the brain are fused to form tight junctions, so most substances cannot actually squeeze between them unless they are quite small. So small uncharged molecules such as oxygen and carbon dioxide, these are fat soluble and they can freely cross the blood-brain barrier. Larger charged molecules, on the other hand, such as glucose, amino acids, and fats, these must be actively transported across the blood-brain barrier. So the difficulty developing drugs for the brain is that an estimated 98% of all drugs that may actually affect brain function and have therapeutic use cannot actually cross the blood-brain barrier. So this has positive and negatives, because if these drugs did pass the blood-brain barrier, then drugs would affect us massively more than we would want them to. But then there are times that we, again, want the drugs to affect the brain, and they can't get there, and this can make it really difficult and challenging. Another important factor is how the body eliminates drugs. So once we have drugs in our body and they're circulating in our bloodstream and they're trying to, in some cases, cross the blood-brain barrier, how is it that the drugs that we don't end up using that are circulated in the body, how is it that they're broken down? Well, these drugs are broken down and eliminated via the kidneys, liver, and the intestines. The liver is especially active in catabolizing and metabolizing drugs. It's capable of catabolizing many different drugs into forms that are more easily excreted from the body. Once catabolized or metabolized, drugs are then excreted in urine, feces, sweat, breast milk, and exhaled air. Substances that cannot be removed may build up in the body and can become toxic. So drug tests then often include urine tests, feces tests. They usually don't include breast milk, but exhaled hair, that's how if you would have a breathalyzer that could detect, the alcohol drug. And it is really important that drugs be excreted and removed, because if they are not able to be removed effectively, then they can build up and become toxic. So there are certain drugs that you take that you have to do continual blood tests, kidney tests, and liver tests to make sure that the drug is being removed from your body and not building up to become toxic.